often should you see your geriatrician? How many times do you need to see your geriatrician in a year, or even at all? If you haven't watched before, my name is Dr. Nicole Didick, and I am a geriatrician. I'm board certified in internal medicine and geriatrics, and I look after older adults. Who needs to see a geriatrician at all? Well, geriatricians usually look after conditions that we can classify under the 5 M's. So that's multimorbidity, medications, mobility, the mind, and what matters most to the person. So I have another video that goes into those in a bit more detail. But generally, somebody who has multiple complex medical problems sometimes is on medications that are numerous or might be competing with each other in terms of side effects. A lot of people come to see a geriatrician because of changes in mobility, so they could be falling or have trouble with balance. And the mind is a big one too. So we see a lot of people who are living with cognitive impairment, like in dementia, which is commonly caused by Alzheimer's, or people who have depression or other issues. And every geriatric assessment tries to get at what matters most to the person. So really, what are their goals and values, and then what suggestions can we make to help the person reach those goals? So I see people with a lot of those challenges. Some people, I'm sure, would like to see me every week if they could. And some of them I'd like to see every week too, because I really enjoy interacting with some of my patients. But then there's other people who I think would be happy to never see me at all. But how often should they come and see me? Some of that depends. So it depends on where you are, whether you're in Canada or the United States, whether you're in a big teaching center or a research clinic, or if you're in a community clinic. Those different settings might have different models of practice. So in the US, a geriatrician is a lot more like a family doctor, from what I understand. So they might do more primary care. So your geriatrician might talk to you about when you need a colonoscopy, for example, or you might call them if you think you have the flu or a cough or something like that, and the geriatrician would look after that. In Canada, most of those things are looked after by the family doctor or primary care provider. And the geriatrician is more of a consultant. In my practice, it's probably a bit of a blend of both. So sometimes primary care providers are more wanting to work more in collaboration and get the geriatrician to look at certain things like certain medications or certain issues, like maybe the depression or the dementia or the pain syndrome. But the primary care provider will look after everything else. So depending on that model, you might need to see the geriatrician every couple of months, or you might only see them once a year. In general, if somebody is stable for the condition that I'm seeing them, I might only see them once every 6 months. If I'm seeing someone who, for example, has mild memory problems and we want to follow them to see if they're converting into a more serious memory issue. So if someone has mild cognitive impairment and we want to follow them along to see if they're one of the people who are eventually going to develop dementia, then I might see them just once a year, because some of those changes happen slowly. And so seeing somebody every month wouldn't really make sense, because things aren't likely to change from month to month. So I might see those people once a year. If I'm trying a new medication or something like that and I want to see how it's working with the person, then I might see them again in a month, or I might see them in 3 months. So some of the medications that we start at a low dose and we have to titrate them up and then see how they work. So it might take a few months to see how that's going to go. If we order a test, then we often want to see people when those test results are back and when they're interpreted, so that we can talk about it and decide what the next steps are. So you can see that it's pretty individualized in terms of how often we might need to see someone in the geriatrics clinic. The other thing too is depending on how the clinic works, you might see a geriatrician and then when you come back, you might see someone else from the team. So depending on your needs and why you're there in the clinic. So you might see a nurse practitioner or a nurse or a social worker or somebody else from the service or from the team. If you're on a research study, then there's probably a pretty strict protocol about when you need to come back. You know, generally, I think it's a good thing if your doctor doesn't want to see you. It means that things are probably stable and that you don't need to have that much close scrutiny. So if your doctor doesn't see you as often as you would prefer, then it's probably because things are going well. So, you know, it can be for different reasons, but sometimes it's for a good reason. So it's not always negative. What do you think? So do you feel like if you're seeing a geriatrician, do you feel like you're seeing them often enough? Have you ever thought about why you couldn't see them more often or why you have to come back so frequently? Let me know, and let me know if you think there's a better way that we could do it in geriatrics. If you want to know more about geriatrics, you can catch me at www.thewrinkle.ca, or you can watch the video that YouTube is suggesting for you right now.